Our programming seems to be focusing on health matters on Rise and Shine today. Let's move to this story now on malaria, where Africa is facing an intensifying malaria emergency with rising infections, stalled progress, and a widening funding gap threatening decades of hard-won gains. In response, global and regional partners have reaffirmed their commitment to protect the most vulnerable and prevent a devastating resurgence. On the sidelines of the recent G20 Leaders Summit, the Global Fund's 8th Replenishment Summit convened world leaders and partners who pledged a US or 11.34 billion US dollars to sustain life-saving programs for AIDS, tuberculosis, and malaria, as well as to strengthen global health security. To discuss this further, we're joined now by Sherwin Charles, who's co-founder and CEO of Goodbye Malaria. Sherwin, thank you for joining us. How are you this morning?
I'm good, Asanda. Thank you.
So, what is Goodbye Malaria? Please give us background in terms of the work you do.
Thank you. Goodbye Malaria was started 12 years ago. We had seen the devastation of malaria on the continent. There were almost 1 million children under the age of 5 in sub-Saharan Africa that were passing away from malaria every year. And I think that for us, our journey took us to Geneva, to Washington, to New York, for us to understand that this challenge that we faced on the continent had to be dealt with by African leaders. We needed to stand up, we needed to be counted. And so we decided that we would get involved in malaria elimination in Southern Africa, focusing mainly in Mozambique, Eswatini, and South Africa. We knew that Eswatini and South Africa had the opportunity to eliminate malaria, and part of the challenge that they had were the imported cases coming in from Mozambique. And so if we took a regional approach to it, dealt with the major challenge at source, we should be able to then assist Eswatini and South Africa to eradicate malaria in the next few years.
So, this commitment comes as experts warn that climate change is accelerating a dangerous resurgence of malaria across Africa. But how far does it go in the eradication of malaria?
I think that one of the biggest challenges we have right now is we entering a situation where there are limited resources that are available for malaria on the continent. What we've seen is most major donors have changed their focus, changed their policies in terms of development aid. And so malaria is a disease where probably over 70% of the resources to fight malaria, both at country level and at global level, is donor funded. And that pot has now diminished substantially. And so the work and the gains that we've had since early 2000 is now at risk. This is further complicated by, as you mentioned, climate change. Areas have seen changes in the rainfall patterns. We've seen higher temperatures, and this has led to more mosquitoes, malaria bearing mosquitoes in areas we've never seen them before. And of course, flooding has changed the malaria transmission patterns across Southern Africa.
So, what impact then is this challenge of climate change having on efforts to eradicate malaria if we focus on how maybe it could accelerate a resurgence of the disease, but also result in many, maybe new strains of the disease?
Yeah, we've seen the climate change really change the seasons for malaria. So typically, malaria would be after the rains and would be seasonal in Southern Africa. Well, those rains are starting to come earlier. therefore extending the malaria season. So normally your peak period would be between November and February or March. Today, we've seen peak season starting now in September and running all the way to April. Um, that certainly is bad news, but also given the intensity of the rain, all the interventions that we do is going door to door to villages, to rural areas, and that the rainy days impedes us getting the work done. And so it makes it more challenging. Of course, when it rains like that, you have limited access to healthcare facilities. So people that are suffering from malaria find it more difficult to seek medical care. What we've also seen is standing water resulting from floods has seen a large increase in mosquito populations. And of course, that then leads to an increase in transmission.
So, Goodbye Malaria, we understand, has also announced a 5.5 million US dollar commitment. It's about 94 million rands, South African rands, to accelerate elimination efforts. Tell us more about this and how this will address the funding gap, especially.
So Goodbye Malaria is a donor to the Global Fund. Our funds are matched by other donors and the Global Fund. We felt that it was important that we were seen to have skin in the game. And so our donation to the Global Fund is earmarked to a grant, a malaria grant that covers, as I said, Mozambique, Eswatini, and South Africa. The pledge from our side is multiplied fourfold by other donors, and that allows um, the the team in the region to continue the work that they're doing. Of course, the resources haven't increased, even though we faced increased costs. But we've continued the work in Gaza, in Yamban, Maputo province, in Mozambique, the eastern part of South Africa, and Eswatini.
So, as that is the focus area, South Africa, Mozambique, and Eswatini region, of course, we know the growing climate as well is going to be a threat for these countries. But what are some of the commonalities then between them in this fight or stand against malaria that they can learn from each other?
So I think the wonderful thing about having a regional grant, we all know that mosquitoes know no borders, but it's allowed the countries to align their programs, to ensure the policies align, to ensure the timing of interventions is complementary to each other. Of course, it also allows them to carry out entomology across all three countries that allow them to understand how imported malaria travels from country to country. In South Africa, for example, most of our malaria cases are what we term imported malaria, meaning it's cases where someone has fallen ill outside of our borders and then sought treatment within the border. And that has been the majority of the cases in South Africa and in Eswatini. By working in a regional program, we've seen the collaboration yield accelerated impact, where now today South Africa and Eswatini are, I believe, are able to eliminate malaria within the next few years. 2030 is a goal that we've set ourselves, and I believe it's absolutely possible to achieve it.
Right. Thank you so much, Sherwin, again for your time, and we appreciate all your efforts there at Goodbye Malaria.
Thank you very much.
Our pleasure. Sherwin Charles is co-founder and CEO of Goodbye Malaria. So a pledge has been signed on the sidelines of the recent G20 Leaders Summit, and this with the Global Fund's 8th Replenishment Summit, which had convened and where world leaders and partners, Goodbye Malaria being one of them, pledging 11.34 billion US dollars to sustain life-saving programs for one of the areas being malaria.